Uh, Welcome everyone to our Ethics and Epidemics panel for today, entitled Ethical Responses to Ebola, Applying Lessons Learned. My name is Ross Upshur. I'm a professor in the Department of Family and Community Medicine and the Dalla Lana School of Public Health at the University of Toronto. And I'm really delighted to be the moderator of this panel with expert speakers to speak on the issues related to the current Ebola outbreak. Just to remind everyone that the chat function that you can use to sort of say hello to everybody and let us know where you're coming from. But if you have questions, please put them in the Q&A, which will help me to prioritize the questions asked. And also, if you like a question, give it a little thumbs up because that will put it higher in the priority list. Also, just to remind you that this seminar is being recorded and it'll be available on the Epidemic Ethics website later in the week. And it's also being live streamed to the Facebook page. So in 2014 to 2016, the largest Ebola outbreak to date was caused by the Zaire Ebola-Virus strain and was designated as a public health emergency of international concern. The Ebola-Zaire strain, which has caused the majority of outbreaks and cases to date, has been the subject of significant research, including the development and licensing of 2 vaccines. In contrast, for the first time in over a decade, the current outbreak in Uganda is caused by the rare Ebola-Sudan strain, for which vaccines are currently under development. So this seminar hopes to explore the lessons learned from previous Ebola outbreaks and how they can contribute to embedding ethics in responses to the current and future Ebola outbreaks. So we have 3 questions that we'd like to focus on. What lessons should we take from prior Ebola outbreaks to inform approaches to community engagement and risk communication, surveillance and infection control, treatment and safe, dignified burials? How do we prioritize and which questions should be prioritized during this Ebola-Sudan outbreak? What lessons should be learned from COVID-19 and this outbreak to inform future outbreaks? And to address these questions, we are very fortunate to have 3 panelists that have expertise in this. Our first panelist will be David Kawa Mafagiri. He's a senior lecturer in the Department of Social Work and Social Administration, School of Social Sciences in Makerere University, Kampala, and has just told us that he's back from the epicenter of the current Uganda outbreak. He's a medical anthropologist with public health training experience, and he integrates biomedical and social behavioral community perspectives to health sciences research and education through robust interdisciplinary training. He embeds this social science research techniques, including ethnography, to improve response to outbreaks and epidemics of infectious disease and antimicrobial threats in the Great Lakes region of East and Central Africa. He's participated on the National Task Force for Avian Influenzas and other zoonotic outbreaks as the lead anthropologist. Additionally, he's a member and secretary for the Makerere University School of Social Sciences Research Ethics Committee, and his research interests include the anthropology of infectious diseases, international health, urban health, and emerging infectious disease outbreaks, preparedness, and response. Our second panelist is Gloria Mason-Ross, and she's trained professionally as a bioethicist at Harvard Medical School Center for Bioethics and completed additional short-term bioethics training programs from the Berman Institute for Bioethics at Johns Hopkins University, the Department of Bioethics at the National Institutes of Health, and the World Health Organization. She is the director of the National Research Ethics Board of Liberia and has extensive experience in structurally transitioning the National Research Ethics Board from a fundamental ethical institution during its stabilization phase to health emergency during the Ebola virus disease outbreak and the existing post-Ebola virus disease recovery period. Presently, she's the executive director of the West African Consortium and the president of the West African Ethics Committee Network. As a member on the National Task Force established to develop a framework for bioethics in Liberia, she brings significant expertise in developing ethical frameworks and institutional structures in low and middle income countries. Our third panelist is Professor Jerome Singh, and he is the principal investigator of the Scientific Advisory Group on Emergencies, which operates under the auspices of the Academy of Sciences in South Africa. He's an adjunct professor at the Dalla Lana School of Public Health at the University of Toronto and an honorary research fellow at the Howard College School of Law, University of KwaZulu-Natal, South Africa. He serves as an ad hoc consultant to several United Nations entities, including the World Health Organization, UNAIDS, and UNICEF. In 2017, he was appointed by the WHO Director General to serve as a member of WHO's International Health Regulations Public Health Emergency of International Concern expert roster. In 2020, he was appointed by the WHO Director General to serve as a member of the WHO's Ad Hoc Research Ethics Review Committee for COVID-19. He also serves on the WHO Ethics 19 Ethics and Governance Working Group and the WHO Technical Advisory Group. He's previously co-directed the Ethical, Social, Cultural Issues Advisory Services of the Bill and Melinda Gates Foundation's Grand Challenges in Global Health Initiative. From these bios, you can see that we have three incredibly qualified experts to inform our thinking on this topic. So without further ado, I'm going to hand it over to David, if you don't mind me calling you David, to start us off. David, over to you, please. Thanks everyone for attending.
Yeah, thank you very much, Ross, and it's a privilege to be here. I hope I am audible. So as I said, coming out of an ongoing epidemic is quite refreshing, and so this is timely to try and discuss, what lessons we can learn to embed ethics in a better way. So Kevin, if you don't mind, we can go to the slides. I have 3 slides just to help us think through some issues. I will say that you can go to the next slide. I will say that my bias starting off will be towards strengthening the role of the social sciences in EVD outbreaks or any other outbreaks. I say this because response to outbreaks is clearly, of course, or understandably dominated by biomedical practice or measures, whether it's getting vaccines or treatments or it's trying drug trials and the like. And so when we think of ethics, I know we are less likely to be thinking in terms of what about the other interventions that are not biomedical, such as those of the social nature. So we now know that when there is an epidemic or a pandemic or any outbreak, yes, there will be a biomedical response, but it will also demand for social intervention, social sciences, whether it is research, or it is community engagement, or it is psychosocial support. There are many ways in which social data, if you will, or social science data will be used. There are many ways in which social science techniques, approaches will be needed. And I think some of these sometimes get thought of very late in an epidemic, and yet they carry with them a very big risk in terms of ethics. So for instance, for me, one of the lessons I think about every time there's an epidemic from the previous epidemics is remembering how much of statutory requirements need to be satisfied to begin with, either when going out to utilize your social science skills, your social data, the response teams, whether it's national or international organizations. When going out, they need a lot of social science data. They use a lot of social science information in a humanitarian emergency. And the question there usually to ask is, how much of the statutory requirements can be satisfied? If it is research, I think it is a lot more straightforward. They will follow the guidelines of the community where they are practicing. But if it is emergency response, what are those levels that they needed to have gone through to acquire or to not violate the ethical standards, or to do their work with ethical integrity? National or international organizations, response teams. And I think for me, that is where I feel there is least preparation, least comprehension about the role of ethics, of conducting your work with ethical integrity. Many times, the country where the epidemic, the outbreak is occurring, apart from COVID, of course, that was worldwide, is usually a low middle income country setting. And of course, has got that struggle between what you would call culturally acceptable, social, the way they deal with social data, compared to the conventional, usually Western-oriented statutory requirements. So one of the lessons for me from prior outbreaks, including even this outbreak, is the way we acquire information that we need, understandably, whether you're doing surveillance or treatment or vaccine trials. There's a way we go about some of this work. You observe and you see that it's a thin line between are you conducting it because it's an emergency? Has anyone reviewed this work? Do you think if you implement certain procedures, certain measures, you are potentially violating certain ethical rights of the communities? Next slide. So the way I'm thinking about what are the lessons learned is to think about the current epidemic, and by the same token, propose these as the way forward. I think questions we need to ask. Remember, again, I'm biased towards this social science data because I feel it's the one that is usually swept over or glossed over easily. So how are we able to maintain ethical integrity, as I've said? I'm thinking about participant privacy, if it were an all-out research, or just privacy of the members who are affected in a community. I know that sometimes when we are conducting this work, you need to pick a lot of information, identifying information. It is becoming increasingly difficult when you're dealing with contacts. You need contact information. An epidemic like Ebola, you need contact information, following up. You essentially are questioning how much privacy you can maintain if you are to fulfill the surveillance requirements. Now that comes to conducting community engagement. It isn't research per se, or it could be part of a research, like in big trials. But how would you go to a community where a few neighbors have passed on or have been sick, and you're trying to, for instance, allay the fears of that community, and you are being asked questions that clearly will require you to reveal certain information? Is the patient still okay? Are they sick? It's medical information. But you see sometimes that when conducting community engagement, even in other areas, you want to reassure them that, the patients who visited the other treatment unit are all okay, or maybe some passed on, or they've been going to traditional healers, so please don't go there. And you're revealing a lot of information. You're dealing with a lot of information. So how can you maintain ethical integrity? It's something we really need to look at. We, as researchers or as response staff, are also faced with a lot of welfare and safety issues. So anyone who is preparing to conduct an Ebola or any other epidemic really needs to think of the response staff. Right now in Uganda, it is very clear that response staff are as much at risk with all the health workers who have suffered from this epidemic, including those who may not be qualified in health sciences. So drivers, hospital administrators, security who are guarding isolation units or whatever it is. So we want to find out I know that if any international organization staff came as a response staff, the only way they would clear them to travel is after they've secured insurance and everything. And even when they come sometimes to these settings, they are limited where they can travel. They may stop in this capital city, may not be allowed to go to the actual epicenter, especially if they are not necessarily emergency like doctors or the like. So you ask yourself, how much of our work maintains ethical integrity if our response staff are not well looked after? Lastly is the social and political context within which these epidemics occur. It challenges some of the ethical principles that we deal with, particularly in an emergency. So we now have emergencies and we are getting used to certain types of responses, if you will, public health measures such as lockdowns and restricted movement, even when that type of emergency may not be of the nature of COVID. But the social and political context within which these epidemics occur can sometimes be a test to the ethical principles during an emergency. And these questions need to be studied. Last slide. I think I'm going on and on. I need to allow for, next slide, please, for some discussion. Otherwise, I think we had 5 minutes. I've gone over 5 minutes. Why don't I stop here and over to you, Ross.
Thank you, David. We can come back to your final point probably in the discussion. I'm going to hand it over now to Gloria. Gloria, please.
Thank you, Ross, and many thanks to the organizers for giving us this platform to share our perspective when it comes to the Ebola crisis that is from West Africa to Uganda. I don't know what else. But in thinking about this topic that is on a discussion, I try to take a step back to, as someone who have lived through the 2014 Ebola and running an ethics committee in the midst of an outbreak with an influx of different kinds of research. You couldn't say it more. And thinking about that, I tried to take a step back looking at how can we find a balance in addressing those ethical issues when it comes to public health response, and how can we narrow down to have a framework that can best describe or guide us as we move forward? Because as you can see now, we are trending in the path that we will always have these different infectious disease outbreaks. But then what measure do we have in place that will guide us to be able to effectively and efficiently address these occurring issues when it comes to infectious disease outbreak, public health emergency? So in thinking about this question, I was more looking at the governance structure. What is it that we have that could be more effective? Is it that these governance structures are not, it's just on book, or it's just being said with words? How can we effectively get this structure in place, whether it's from through our Ministry of Health or the respective countries. How can we improve the system? How can we maintain trust by the people? Because if you have these different outbreaks, what mechanism is in place that can really give the people the reason to trust, whether it's the government, because a lot of times it's the government, and then it's a lockdown, it's a quarantine, it's a isolations, but how are these processes? Because sometimes, most time, public health response turn to limit their individual autonomy, which have to do with their right to movement, their rights to freedom, or their rights to say certain things. So a lot of times these are questioned. And also the issue of transparency, accountability, and even with the community involvement. How do we get the community involved to be part of the process? So once the outbreak is over, yes, we drop everything and move on to the next step. How can we strengthen our communities, the health system, strengthen it as well? How can we improve the community health system and health facilities, that they will be more prepared whenever there's an outbreak, they are prepared to address these concerns. So it is important, I think, when it comes to taking back from what we've learned. I mean, moving forward, even with the COVID-19, I felt in my own mind there was still challenges, and lesson learned from Ebola moving on to COVID-19. I didn't see much of a change, because if you say quarantine and then you move on to the next one, you see the same trend, is the same pattern when it comes to trust. And so I think there are a lot of issues when it comes to the ethical principles in guiding or response when it comes to infectious disease outbreak. And I think it is important that as we move forward, if we cannot get the community involved, empower the community to be more prepared whenever there's an outbreak, and community ownership. When can the community take ownership of these different disease that is, I mean, lavishing our different countries? How can the community take ownership? Because a lot of times when these outbreaks are on the way, we run to the community, but yet they are not empowered. They are not up to the task to address these concerns. Even with this, the little facility, the little health facility that is within those communities, do not have the requisite materials to best combat the different viruses or disease that we are responding to. And I think there's not much has been done when it comes to preparedness, and I don't know, but I think we still have to look into when it comes to preparedness of an outbreak. And if we cannot be more effective and efficient when it comes to preparedness, we're going to still be trending on this path of what lesson can we move on. But we have a lot of lessons we have learned. But I think it's about time that we take a step back and go back to all of those things that we've learned, and move and try to improve the system. How can we get them on the way that whenever there's an outbreak, we move out to the same pattern and best address those specific issues. So I will stop here for now, and as we move on. Thank you. Over.
Thank you very much, Gloria. I'm going to hand the floor over to Jerome. Jerome, please.
Thanks, Ross. So I'm going to try to keep my comments really quick, and I'm going to try to focus on just the questions that we were asked, and try to maybe speak on some of the issues there. So I think, what we were asked to maybe address in some sort of detail in the short time that we have is, what are some of the research questions that should be prioritized during the outbreak, this particular outbreak? What lessons should be learned from COVID-19, and how can we apply these lessons to informing preparedness in future outbreaks, and in particular this outbreak? And also, what lessons should we take from prior Ebola outbreaks? And I think one of the important things that I want to start off with, and I'm just going to echo some of the points that have been made already, is that we have to really understand, how do we foster trust? There's a lot of mistrust in countries globally, especially mainly with government authorities, and also to a certain degree with scientists as well. And I think, we have to ask important questions. How do we facilitate trust? What is the current understanding of the disease in that particular setting? How good have the has the government been in communicating transparently and honestly in terms of where the outbreak is, where the outbreak could actually go. And I think, in terms of lessons that we should take, starting off with that, lessons that we should take from prior Ebola outbreaks. I think, what we learned from the previous Ebola outbreak was that there were lots of gaps in governance and in research ethics in many of the countries in West Africa. And I think the important points that we need to consider in the current outbreak is, has, for example, the current government put in place regulatory mechanisms to allow for the import of emergency interventions, either alternatively in the context of clinical trials, and more importantly, even if there's trials that have already started, what post-trial mechanisms have been put in place to ensure that efficacious interventions will eventually reach the affected communities. And I think we also have to have a good understanding of what the requirements are of these interventions. Do they require cold storage? Is there cold storage facilities in that country? And these are lessons that I think we should have learned 5 years ago. And I think when you're looking at potential outbreak countries, the authorities in those countries, I think, have to have a hard look in terms of whether they've learned any lessons from previous outbreaks. So I think, an important other aspect in terms of lessons learned, we've learned this from COVID, is how do we manage information? There's a lot, we talk about an epidemic of information. There's so much of information out there. Most of it is lies, half-truths. And I think we have to start looking at what are authorities and scientists doing about managing misinformation and disinformation, because these are the drivers of undermining trust. I think important lessons that we should also have learned by now is that you can't impose scientific norms and requirements on cultural expectations. And by that, I mean, we have to understand, for example, what the local customs are in the affected region. And, there's several different places now where there could be outbreaks. And I think understanding that a country is not homogeneous, communities are not homogeneous, there may be very different ways of handling the dead in different parts, different types of rites and rituals. And I think also in terms of what we should have learned lessons from is that it's not just engagement with potential participants of a trial, but it's also understanding that engagement has to occur with a wide and diverse group of different stakeholders. We have diverse constituents living in different places. And I think this includes local politicians, not only national politicians. We often have the Minister of Health or the President, but at the end of the day, there's a local ward councillor in a particular area who's the local politician. So we need to have multi-party engagement, not just one political party. You need community leaders to be engaged. Faith leaders need to be engaged so that we're not going to have funerals in a way that could facilitate the spread. We need to, more importantly, in the context of Africa, is engage with traditional leaders and engage with traditional healers. These are all very different groups. And I think that the lessons we should have learned previously is that this type of engagement and process should have started really very early on. So, we can maybe handle some of the other issues as we going through the panel, but I think also we have to start also not only engaging with those stakeholders, but especially in the context of Ebola, is we've got to look at those potential drivers. So in other words, are we doing relevant engagement with funeral parlors and with morgue staff? Are we actually looking at engaging with undertakers? These are not traditional communities, but I think for the purpose of Ebola, we need to consider that particular sector as a community, and we need to engage with them so that we have safe practices put in place here. In terms of lessons that we should have learned, and I'll just maybe end off here now, is research questions. I think probably we need ethnographic and we need qualitative research to understand where the community is and what the community understands about these issues. And these types of studies need to be done in a time-sensitive way. We need to understand, as I mentioned, the drivers of misinformation and disinformation, the potential barriers to accessing successful interventions or efficacious interventions. And I think also, lastly, we need to really take into account lessons that we've learned from COVID-19. And that is when we have lockdowns and when we have constraints on mobility, we're going to be affecting young learners. And how is this going to affect cognitive development? How is this going to affect education? And how is this going to affect learning and teaching? And these are some of the issues that I think we need to take into account. And lastly, I'll also just mention that we need to take into account the principle of reciprocity, which is a very important ethics principle. And that is, if we are asking communities to take on huge sacrifices and confine themselves to their home when they may in fact be sacrificing their livelihood, I think we need to ask ourselves, what are authorities doing to compensate these people? Are they giving out food packs, hampers? How are these people surviving day to day? These were gaps that I think were not properly addressed during COVID-19. And I think these are some of the issues that we need to look at in the context of this current epidemic. Thank you.
Thank you, Jerome, and thank you also to Gloria and David for excellent presentations. So I'm going to try my very best not to insert too much moderator interest into the question periods, but now is the time for participants to ask their questions in the Q&A chat. Now, David, I'm going to come to you first because I guess your slides froze and you had one additional point to make. And if you want to make that, then I have so in this framing of lessons learned, maybe the panelists could enlighten us as to if there are lessons to be learned, who are the teachers, who are the students, and where is the school? We heard a lot about better integration of social sciences and ethnography and building of trust. Those are kind of key themes that emerged. So David, I'm going to give you a chance to make your final point, and then we'll open up the floor to discussion. David, over to you, please.
Thank you. Thank you very much, Ross. Actually, my final point had been lessons that we think we can carry from COVID pandemic that Jerome has touched on very well. The one thing I will emphasize is commitment. We need to be sure commitment to engage communities. It's just a must. The way and the different communities he has broken up, specialized ones, you know, it could be funerals, homes, or undertakers, or, you know, any of these other communities in the respective areas. And then two, I also know that these pandemics really question the methodologies that we use to collect an information, the conventional approaches we are used to. If you're thinking of ethics, you are thinking, and there is a public health measure that says, you know, I don't know, you shouldn't be 6 feet together or something like that. And you know that in some of the methods, at least in the social sciences and other fields, you need to be face to face and talk to these people. You know, what does that, how does that then affect the methods we are using to generate some of this information? There are methods that require you to discuss in groups, and you are told you can't have a group, but then you go out and find all this information, and you don't know, are you violating privacy or confidentiality when you have 6 people standing around in a lot of space speaking up on top of their voice? You know, you violate a lot of privacy. But to your question, I wanted to say, yes, where are the schools, who are the teachers? I think we need to listen a lot to the communities. For me, that I have found, I learn a lot when I go out to an epidemic and go with a very open mind and listen to reasons they are, you know, taking the decisions they take as local community members. So aside of specialized knowledge that you get in a school, in a class, or a degree telling you this is how you do 1 or 2 things, just being modest, polite, you will learn a lot and cope. At the same time, you use your skills just to be sure you maintain rigor and ethical integrity in what you do. But I think for me, the important thing is we really need to make these community engagement or participation or whatever other words much more real, much more substantive. I'll first stop there.
Great, thank you, David. Jerome or Gloria, did you want to add on what David has just said? Give you both an opportunity. Gloria? would you like to
Yes.
add in about who the School of Masters are and who?
Yes, yeah, thanks, Ross. So just to add up to what David said, I mean, we said that in our opening statements is the issue of communities. I will give you this scenario we faced. So during the Ebola outbreak, there was a clinical trial and the community wasn't involved, even though the ethics committee have earlier approved this study. But again, when the study started within that community, there was some reaction from the community, like they weren't informed. How can you conduct a clinical trial only because you feel that this place is the best place, it's overpopulated? So like David said, the issue is you will get all the information from the community. So if we empower our community, it can be the teachers, it can be the student, and we as the experts can be the ones to listen more and learn from them, because they are the ones, even when it comes to surveillance, when it comes to the burial, all of those issues that comes with that has to do with response to whatever disease spreading. I think the community plays a huge role. And if we focus on that, I think we'll have a real direction in moving forward, addressing some of the ethical concerns that we have when it comes to outbreak response. Thank you.
Thank you, Gloria. Jerome, would you like to add on to this?
Very quickly, I'll just say maybe that to have teachers and to have schools means and assumes that those schools are being engaged and even exist. You know, I think that in Africa in particular, and globally as well, I think schools that actually, we're talking about departments, academic departments that drive ethnographic research, qualitative research, they actually are the poor cousins in the research realm. They're underfunded, they don't exist. And so you find the top brains of Africa end up leaving and going elsewhere, doing their research elsewhere. And when there's time for really important research to get done in Africa, some of these people are either not there, or alternatively, they're there and they're just not funded. So, you know, we can have the schools, but we need some funding from our governments. So governments need to put their money where their mouth is if they want to be responsive to the health challenges of Africa. Fund your qualitative researchers and fund your ethnographic researchers. So in terms of the schools, I think some exist and some exist, but they're underfunded and some are poorly resourced. So, you know, I think those are the big challenges that we have in Africa.
Great, thanks, Jerome. In my experience in over 20 years of working on various different pandemics is that the social trumps the biomedical in terms of how we roll things out, but the funding and priorities work in reverse order. So I think this is an important message that we need to somehow communicate. So a question from the audience. So, and it's one that's kind of dear to my heart as well. What lessons have we learned from one outbreak to another? And more importantly, what systems do we have in place or are being put in place to respond to them? And so this is now, I think, a chance for the panelists who've reflected and are experienced in these areas to say, how would you envision a system of taking what you've learned in your professional experience working on Ebola outbreaks and other outbreaks to have kind of a record somewhere that people could turn to? A big question. I don't know who I'm going to, I'll pick on Jerome first, and then I'll go to Gloria and then David. I'll go in reverse order.
Okay, so Ross, I think a lot of lessons that have been learned have been captured. Not everything, but I do think that, you know, lessons are learned on a daily basis. But I do think that there's quite a large repository of information that's out there, both ethics and other disciplines that have documented lessons that have been learned from multiple pandemics over multiple decades. You know, you go back to SARS in 2002, on the beginning of the century, and you look at how many times we've had global pandemics or even major local epidemics that are quite fast moving and unpredictable. Lessons have been documented and learned. And so I think the issue here is there's a huge repository. It's about curating that repository and also making sure that those lessons are learned and adopted, or else we'll keep on reinventing the wheel.
Thanks. Gloria, your thoughts, please.
I think for me, I'm more sort of from the ethics committee standpoint. One of the things that we thought were more effective and efficient was to develop an emergency guidelines to best address some of the problems that we face going through the regular process of submissions and review process. So one of the things that was more efficient for the COVID-19 in Liberia was the ethics committee had to develop an emergency guidelines to best whether to expedite or to give or turnaround time within ethics committee review process. And that was, we thought that was more efficient, and we were able to address more research research conducting within the COVID period, other than our regular time that we have to go maybe 3 months, 60 days or more. So that was more effective. And I would say this, when it comes to the issue of addressing a lot of these concerns and moving forward to lesson, I think we've had a lot of lessons. I think all we need is how can we put our hands down and begin to really make these impactful within our communities, and how can we transcend this model to other areas, whether it's research, whether it's data safety, whatever means that we can use to get this on our way. I think it's important. Thank you.
Thank you. And David, would you like to comment on this, please?
Yes, thank you very much. Sadly, I think also one of the lessons that we have learned is that we continue to make some similar mistakes. We know that, you ask yourself, we know that during each epidemic, we are unable, we feel we know what we need to do to prevent another outbreak, but you can almost predict that there will be another similar outbreak not many years after you've controlled one. And you ask yourself, why is it that we simply cannot stop or prolong these outbreaks, the gap between them? And for me, one lesson has been that that we hope one day we'll take. We have to be sincere with the way we view science, with the way we view the power dynamics between the people who are affected and those that have the ability to control these epidemics. And the power dynamics are such that Jerome has hinted a little bit. For example, the schools, the skills levels, and all that stuff. It just will not change if some structural factors don't change. So livelihoods, cultural practices, all these things are going to get blamed over and over. You can almost certainly predict until we change some of the inequalities. So I don't know if that's a lesson, but for me, the lesson is we will not be able to stop more pandemics if we keep dealing with these symptoms, so to speak. Over.
Thanks, David. So one of the questions we were asked to address was how we set or which questions should be prioritized. And David has made a very persuasive case for greater engagement with social sciences and using ethnography. Gloria and Jerome have emphasized trust and community engagement. We have a question from one of the panelists about origins and the idea that if we haven't attended to the origins of Ebola, and if they're not settled, we're going to still be in there's sort of ethical consequences attendant to this. So given that there's a wide number of questions, even though we have learned lessons, how would we go about, so if I were to ask you to each choose 3 top questions to prioritize, let's say by some miracle we put you in contact with the leading global decision maker, and they're going to fund and give priority to the 3 questions that you want to ask, what would those questions be? And I'm going to start this time. I'm going to go into the middle and ask Gloria first. So you've got 3 questions you can ask the powers that be, and by virtue of the power invested in me, they have to fund and resource these questions. Over.
Thank you, Raz. So for me, I think we 3 questions. Oops. So one of the question is, so we talk about the origin of Ebola, and then we see there are a lot of different trench. There are a lot of different trench of the Ebola. You have the Sudan, you have the different. So I think it would be really important to really develop the different vaccines or therapeutics on these different viruses that we still struggle with. I think once we have those, so I think developing a research in these different areas to study different kinds of Ebola or whatever disease, I think it will be something that it will worth moving forward. And another questions I would think when it comes to the social sciences, just to know, what method can be used within the different communities that maybe that we have used before, maybe it wasn't working or it's worked, what has changed. I think we should also look into really understand the in-depth from the communities in terms of what they want, what are the needs are, understand the community needs, what can we change, what has been different and what can we change. I think that would be my second research question. And also when it comes to, I will look at the genomic aspect, to look further deeper into understanding the different change of the Ebola and how people respond. And also maybe I will add one more, mental health, because we understand that both the COVID and the Ebola also bring about mental health issues, and that's one of the issues that has been less talked about. And I think maybe look into some of the mental health challenges when it comes to decent burial of family members, even those who are doing the incrimination. What are some of the mental health issues that they face with that, and because they come back into the community, how can we also look into that? So I will stop here and get for my colleagues. Thank you.
Thank you. Over to you, Jerome. I'll give you following Gloria there.
So I'll keep this short again. I think probably what we need to understand is we spoke about lots of issues, including things like, what is the source origin of the disease, but ranging all the way through to, community issues and what community concerns are. But I think all of this speaks to, from our context in the discipline that we are talking about, is understanding what are the social and cultural factors, norms, practices that could actually drive the spread of Ebola and also impact on risk mitigation. So we know, for example, certain cultural practices could facilitate the spread, certain funeral rites could do it, bushmeat eating, animal trading, illicit trafficking. Those are some of the drivers, and we need to understand what are the social factors that drive those phenomena. So I think, in terms of me and the research questions that are important to understand is understanding the local social norms and practices and cultural practices that could impact on the control of the disease. I think we also need to understand what are some of the ethics and regulatory barriers to quick access to efficacious interventions. Will this be important under, will the research be done under what we call a MURI framework? Will it be done under, will post-trial access occur under emergency use? Does the country have those things? We need to understand these types of, to understand the environment. And I think also we need to also understand what are the deficits in the local regulations and laws, and how do we actually, how could these factors actually impact on the control of the pandemic? So these are just three in addition to what my colleagues have said.
Thank you, Jerome. David, your wish list, please.
Thank you so much. In addition to all those above, I would say we, in more specific terms, some of the social cultural contexts, barriers, or we may call them challenges. Those need to be, that may become challenges to controlling epidemics, or that may contribute to the risk of epidemics. And I say this because these cannot just be studied when the outbreak is on. For certain settings, we need to have a way that these can be studied continuously. So there has to be either teams or working groups or something like that. Just knowing environments that are at high risk and establishing cultural, social cultural factors, drivers, potential drivers. Then two, I would think also about the challenges of communication channels. A lot of communication channels being used every day as the technologies have improved, as people are moving a lot more. And I think we need to be able to understand some of the challenges of these type of communication channels, because they too are increasingly big drivers of these epidemics. You know, if you cannot, as a response team, establish yourself within the mainstream channels, there's not any amount of education about what causes Ebola or where to go that can stop the local community from going to these other alternative healing and other. So just understanding those communication channels, and it would cover not only the community, but the way we relate north-south, you know, funders of responses and those kind of things. In the communication channels, we include just the cultural perspective of, here is an expert coming down to this area of need, and how are they relating with the sitting governments, government officials, what kind of communication. So communication more than just the actual channels that influence rumors or infodemics. Lastly, related to ethics, I think one of the challenges we need to study is how epidemics, you know, can impact or need to be prepared for, can impact ethical clearance, ethical statutory requirements, and that flexibility. Because conventional thinking is that you know, you don't need a lot of ethics clearance, it's taking long, they don't. New epidemics like, or pandemics like COVID really were a challenge for any regulatory body, because there was not enough information, not enough. So what do you do? All that. So I think equipping these ethical regulatory bodies and platforms is something that needs to be studied. How can they be best equipped to manage during epidemics, particularly in less low middle income settings? Thank you.
Thank you, David. So just picking up on a point you made there, and sort of as we're getting close to closing time, it's been a rich discussion and there's still so much more to be said. So David, you raised the interesting and important point about how work needs to be done in between pandemic, you know, in peacetime, so to speak. We've had, more and more public health emergencies of international concern. In fact, the alarm, as it's called, has been ringing since 2014, since polio was declared a public health emergency of international concern. Since then, we've had Zika, COVID, and monkeypox, and now another Ebola outbreak, the Ebola in Congo was also declared a public health emergency of international concern. So peacetime doesn't seem to want to exist, but I think we really need to think about how we think about things. I mean, community engagement, reciprocity, building trust has to take place, or will probably be most effective in a time where communities aren't under the pressure of lockdowns and countermeasures. So I guess in your final comments, if you could just sort of envision what a regime would look like globally, that would help facilitate a better attention to this. Obviously, we need more resources. We need to see the social, cultural, ethical components on equal footing to the clinical trials platforms. So I'm going to ask people for their last comments, and I'm going to start, Gloria, with you. If you'd like to give your final framing comments, then I'll go to Jerome, and then we'll begin where we ended with David. So Gloria, over to you, please.
So once again, I just want to I just want to thank the organizers for having us on this platform. One closing comment, I think we still have the chance to change the narrative, and it's only us as people from our different respective countries that can change it, so to change this whole aspect. And if we don't have a clear governance structure, if we cannot make sure that the information that is going out there is clear and continue to build trust among the people, we will continue to face and go in circles when it comes to addressing public health emergencies, disease response, disease outbreaks, and all of the different burdens that we experience over the last 5 years, and COVID, and another Ebola outbreak in Uganda. So I think we need to have a clear structure, governance structure that will best guide us as we move forward. And then moving on to all of the lessons that we have learned, applying those lessons, I think it would be really helpful in our communities and empowering the communities, making sure the ethics committee regulators are strengthened enough to address these different kinds of public health emergencies. Thank you once more.
Thank you, Gloria. Jerome?
Okay, so I think at the global level, the WHO is actually doing far better than they have done for many, many years. They've got several working groups now that are made up of people from different regions of the world, and they give different perspectives on the issues that affect them. So I think, that's been a very helpful evolution in the context of the WHO, where they've now got committees that actually very actively and on an ongoing basis reflect on these issues in a time-sensitive way. I think at a local level, where governments are failing is that to consider some of the important issues, all of the many diseases like Ebola and also issues like COVID initially were dependent on behavior and self-control. And you were not going to be able to change people's behaviors and attitudes by giving them only biomedical interventions. You can't out-treat a disease or a pandemic. You've got to be able to understand and change people's behaviors as well. And this is where I think a lot of government task forces failed miserably, because they packed those committees with medical doctors and epidemiologists and failed to take into account the views and the roles of ethicists and social scientists as well. So I think, when you pack a committee with over-representatives of certain sectors like epidemiology or medical doctors, you just get an echo chamber, and they're not going to add anything valuable to change people's behaviors. And I think to change people's behaviors, you need to have those people who are experts on that. So at a local level, to sum up, I think you need to get your ethicists, you need to get social scientists, ethnographers, and a multidisciplinary representation on advisory panels. And at the global level, I think that started, and it's much better than where it was compared to where it was even 5 years ago.
Thank you, Jerome. And David, your final comment.
Yeah, thank you very much. I think in addition to what Jerome and Gloria have said, I would say, again, related to community engagement, I would say that there's failure, if you will, I'll use that word, failure to implement community engagement as part of a pandemic response. And what do I mean here? There's a big tension between, on the one hand, governments have an understandable intent to rapidly implement public health measures. So it's understandable, it's an outbreak. And there's that tension between that versus a sort of perceived slower approach where you begin mobilizing communities, engaging communities. Where do you lay emphasis? So you find that if you perceive social sciences and other fields like ethics and other humanities to be more into this slower approach, then there's less attention paid to that important role. Yet we now know very well that, as Jerome has said, you may not be able to, communities may not change their practices or even behaviors if they have not grasped the value, the seriousness of the health threat. And they can't grasp some of that seriousness, in the immediacy, particularly if they're not affected. So I would say one important thing is to continue to emphasize that some of these fields, ethics, social sciences, and other humanities, need to be embedded within the response, so that anything they suggest, it's not either coming to firefight because a community is rejecting one or the other intervention, then you say bring social scientists to cool them down. There's a lot of firefighting usually. But in the peace times, for example, do you fund social science work as WHO to go in, or as any other organization? Thank you.
Thank you, David. So it's time to close what's been an absolutely fascinating and stimulating panel. Gloria, Jerome, and David, thank you for your time and your insights. And also thank you to all the participants for attending today. Just to remind everyone that the recording will soon be available on the Epidemics and Ethics seminar page. And you can click on the website to see about the future seminars. And you can also follow us on Twitter, LinkedIn, and Instagram. So thank you for being part of this. We look forward to seeing you at future engagements. And once again, Jerome, David, and Gloria, thank you for your incredibly insightful and thoughtful presentations. And with this, I will bring proceedings to a close and wish everyone a good day. Goodbye.